morning, everyone. I want to thank Nathan Crane and Jean Swan for taking on such a platform of health, because they are not only interested in cancer and changing how the medical care is delivered, but also enlightening and empower people here and all over the world about what's really available to them. Also, we want to welcome our illustrious speakers here today that will illuminate so many different subjects. And then, last but not least, I'd like to welcome our attendees today who have the interest to change things, and they are going to be the ambassadors in the army, so to speak, to change the world. And that's what has to change. So we're talking about, it's interesting. We're going to be talking about cancer and how it works and how you win. My thing is not working. No. I wonder what's going on. Oh. Well, one thing we want to talk about is that cancer is not full of doom and gloom. A lot of my patients go to the doctor and they say, "Oh, I just went to Dr. Doom. And he just told me the grim prognosis." And I said, well, as far as I know, there isn't anyone on the planet who is able to give you an expiration date. And so, so with that said, I don't want this to be a doom and gloom weekend. This is going to be an awakening, an enlightening. It's going to be an empowering. It's going to be a ha-ha moment for somebody. So Edison wrote this quote a long time ago, and it's kind of the wave of medicine that is happening today. I know you might find it difficult to believe, but there are doctors all over the world now who are interesting their patients into the cause and effect of disease and in the prevention of disease. So I know a lot of people go, I went to my doctor and he doesn't know this and he doesn't believe in this. But actually, there is an incredible wave of new doctors that are changing the way that medicine is being delivered. This is a picture of my clinic, and we have tried to create a non-traditional medical office that the patients have a healing field and a healing experience when they're at our office. So what kind of testing we do? We do, like Jean said, we do all kinds of testing, because if I'm going to figure out the puzzle of you, I need lots of little tools. And some of the tools here are listed here. And do we do them all on everyone? No. We do them depending on what your individualized, personalized needs are. So what is cancer? Well, cancer is crazy making. It is a cell that has lost its integrity, it's lost its direction, and it is creating havoc in your body. And as I mentioned there, if you look here, cancer is fundamentally a mitochondrial dysfunction. You probably don't know what mitochondria are, but mitochondria are the little cells in your body. You see on the left-hand side is a dead cell, and the right-hand side is a live functioning cell. And your mitochondria are the powerhouse engines of your cell that make your ATP. Translated, that's the currency of life. That's how you get up in the morning. That's how you function every day. And that's how each cell takes care of itself. So when all of our speakers are going to be talking about toxins and all the interfering fields, this is what happens. Now, we also have something in our cells called peroxisomes. Peroxisomes are the cells that are responsible for detoxification. And I'll talk about that when we talk about the causes of cancer. Just as Jean Swan said, cancer rates are alarmingly increasing, not only in the United States, but all over the world. It's about 1 in 2 people. But that's just what we know. What is it that we don't know? Like, let's take heart disease. What's the #1 symptom of heart disease that's responsible for immediate death? So the first symptom is sudden death in 50% of people. So how do I know I have cancer? Let me tell you one thing right now. Prevention is priceless. You want to know if you have cancer earlier than later. From one cancer cell to the tumor is about 10 or 12 years. So a lot happens before that doctor or the scan or the mammography or the colonoscopy reveals cancer. Now, we've known, interestingly, for a long time how to figure out if we have cancer. But unfortunately, the conventional medical community doesn't quite open themselves to these options. But I'm going to tell you today, because I do it every single day, and not only do I, but I have a team of many doctors and many practitioners that all do it. So definitely, it's real, it exists, and you're going to learn about it today. So how do you know if you have cancer? Well, there's a couple of blood tests that your routine doctor, your conventional doctor, can order, and that's called the CRP. The CRP, so please make sure, because he's not going to go, oh, that's weird, I've never heard of that. He's not going to say that. CRP. CRP is a marker for inflammation. There's a great new book out called Inflammation Nation. If you have inflammation, it's the precursor to all diseases. And interestingly enough, I have found that levels of just, normal is less than 1. I have found levels of 1.8, 2.5, 3 being going to be revealing to me cancer. So you want to make sure that that number is less than 0. HCG. You've heard of HCG diets, right? You've heard of HCG in pregnancy. Well, HCG is also the malignancy hormone. And that's a simple blood test that your lab can do. And then I will talk about a little bit more sophisticated testing. Now, hemoglobin A1C. If you're a diabetic, you know what hemoglobin A1C. It's a reflection of your blood sugar over 90 days. But there's no single greater marker to be watching in your body, because if you have elevated blood sugar, you're increased risk for cancer, diabetes, Alzheimer's, and all other diseases, because sugar is a poison and it is a toxin and paralyzes the cell from taking care of you. Now, here's a blood test called the Cancer Profile. It's a special blood test done by a laboratory in Florida, and it checks these things on there. The HCG, 2 markers of urine, 1 of blood, 2 of blood, 1 of urine. PHI is an enzyme of anaerobic metabolism. It checks DHEA, which is your hormone of stress, immune, and longevity. It checks for CEA, which is a marker for non-specific cancers, lots of cancers. Your TSH is a marker of your thyroid. If your thyroid is low, your metabolism is low, and your battery is low, and you're higher risk for cancer. It also will check for liver function, GGTP, because your liver is your organ of detoxification. Now, this is called the Bioimmune Survey. There are about 100 doctors in the United States that perform this. I learned about it from a gentleman by the name of Bill Curry. And Bill Curry had cancer himself. By the age of, when he was 21, he had osteosarcoma. And at that time, when he was 21, that was probably 40 years ago, and maybe more, I'm thinking about 45, 50 years ago. And at that time, the treatment was amputation. So he asked the doctor, he says, do you know my name? And the doctor didn't know his name. And so he says, well, I'm leaving since you don't know my name. So he left the hospital and he went on a discovery odyssey to figure out how to cure his cancer. So I learned about it from him about 17 years ago, and I've been utilizing it ever since. You have acupuncture points on your fingers and toes that correspond to every organ in your body. A brilliant scientist by the name of Reinhold Voll, V-O-L-L, you can look him up, in the 60s taught the classes. He was a physicist and a medical doctor that determined this. And when he figured, so the volumes that he used to teach manually were about 1,000 pages each. There were 2 volumes. I learned about it from an acupuncturist. And then it became computerized on a machine called the biomeridian. So I can tell if you are brewing, simmering, or fermenting cancer in your body by that. Not only that you are, but where it is and what could be contributing. Is it because you're allergic to wheat? Is it because you have pesticides? Is it because your body's flooded with radiation or whatsoever? But it is an incredible test, and usually I can determine that in about year 1. The Oncoblot test came out a couple of years ago. Malignant cells make a protein called Inox protein. This Oncoblot to determine if you have cancer and where. The only downside is it gets it about year, I figured out about 6, 7, 8, something like that. I want to get cancer earlier than that. So, but it is a helpful test, so I don't want to discount it. The other thing, in 2012, the oncology books have written that you only have a remission of cancer or cure for cancer if your circulating tumor cells and circulating stem cells are 0. Now, I don't know if you guys have ever heard of that, but there isn't very many doctors in the U.S. that utilize this test. It's actually an FDA-approved test for breast, colon, and prostate. Unfortunately, the lab here in the United States doesn't quite have the expertise of figuring out the exact number, because I have used them on numerous, and so I stopped using them when I kept getting 0, and I said, I know this patient can't have 0. So I use a lab in Greece. It's called RGCC. RGCC started 10 years ago by a doctor by the name of Dr. Papitsarou. And Dr. Papitsarou is an MD, PhD. It has the highest world laboratory certification for measuring circulating tumor cells and circulating stem cells. So I can figure out with anyone's blood test here today if you have circulating tumor cells and stem cells. If you have a tumor of even 1 to 2 millimeters in size, which is undetectable by a conventional MRI, you will have circulating tumor cells and stem cells. Thermography. Ty mentioned this yesterday. Thermography is a wonderful, non-invasive, painless procedure for women to have an evaluation of their breast. Thermography uses infrared camera that doesn't hurt you, doesn't touch the patient, and it will tell you if there's cancer in your breast. It shows a vascular pattern because cancer cells are very hypermetabolic. I usually determine cancer, I would say 9 times out of 10, through thermography before mammography.